Okay, so tonight we're going to talk about CPAP, which is continuous positive airway pressure. So we're going to talk a little bit about that. Okay. So I already mentioned continuous positive airway pressure. So aptly named, it has a continuous positive pressure. So when the patient exhales and inhales, there's a positive pressure of the air coming into the mask. So that allows it to always keep the airways open, and it works in specific instances, mostly to keep the alveoli open. So those are those little air sacs at the very bottoms of your lungs, which is where all the gas exchange happens. And so when those get collapsed, you're not getting adequate airflow to where the gas exchange happens between oxygen and carbon dioxide. So keeping those open as well as the little airways that go to it to provide for that efficient gas exchange. So in order to make this system work and to have a positive airway pressure system, is you need to have a really tight seal on the face in order for that to happen. So if you can imagine, if you're shooting positive pressure but it's leaking out the sides or leaking out the nose or anywhere, you're not going to get that positive pressure. So you need to have a very tight-fitting mask, and some people can tolerate it and some people cannot. So you're going to start with a lower pressure and you're going to work your way up. So you're going to start in like the 2 to 5 centimeter of water range for most conditions, and you would stay at 5 centimeters of water for most things. However, if you're really suspecting heart failure that's causing that, CHF, so congestive heart failure, then you would consider going up to 10 centimeters of water with that. So if somebody is coming in and saying, you know, I've gained 10 pounds in the last 2 days, become short of breath, my legs are really swollen, I ran out of my water pill a week ago, you know, and I don't have a very good heart, I have heart failure, that, you know, gives a pretty good situation for a good scenario for CHF, heart failure, and so then you'd probably go up to that 10 centimeters of water. So yeah, 5 centimeters of water is good for most of the other issues. So why would you put on continuous positive airway pressure? So there's 3 cases where it's very obvious. So in acute hypoxemic respiratory failure, so somebody unable to keep their oxygen saturations up, you know, breathing really fast, that is a sense. So like pneumonia, flail chest, possibly near drowning. We already talked about congestive heart failure, and that's the sense where you would have kind of the higher pressure on that. So chronic obstructive pulmonary disease, so COPD, asthma, or other types of bronchoconstriction, you know, chronic bronchitis, emphysema, you know, exacerbations of those, that would be a good indication for the continuous pressure, positive pressure. You hear people talk about CPAP in obstructive sleep apnea, and in, you know, when somebody has sleep apnea and they wear a CPAP at night, that's a common thing. It also a lot of times can go along with something called obesity hypoventilation syndrome, and in both of those syndromes, a lot of times it's the tissue in the throat and the back of the mouth that are blocking the airway. And so what you're doing is you're putting lots of pressure back there to kind of tent it open a little bit, okay? Go to the next one. There are, though, indications that you would not use a CPAP. So the patient has to be awake in order to do it. Like if they're unable to manage their secretions, if they're not breathing at all, or if they're vomiting. So this is a mask that's going to be attached to their face, not easily ripped off. So if somebody's out of it, you're worried about them vomiting, that is a reason to not put on a CPAP. So in somebody with cardiac arrest or a respiratory arrest, so they're not breathing at all, their heart has stopped, that's not an indication for a CPAP. In that situation, you would do the bag valve mask, or, you know, a supraglottic airway like the King, if you're trained in that. So, like I said, severely impaired consciousness, If they have trauma to their face, I would not put a tight-fitting mask over their face. Or if they have a really bad, like a pneumothorax, like chest trauma, I would not do that. And then there's this other indication, if they've had a recent esophageal anastomosis, that means that their esophagus was taken apart and put back together. So an anastomosis is where you put something back together. So the reason you won't want to do that is because when you do put lots of positive pressure down, you're going to put it down the trachea and into the airways, but some air is also going to get down the esophagus. So I would not put a lot of pressure on the esophagus if they've had recent surgery to reconnect it. Okay? So, yeah, so this is what the system looks like. So it's a tight-fitting mask that goes all over the head, and we're going to talk a little bit about that. So I'm going to grab this. So what we're going to use here, there's a couple different systems that you can use, but the one that we're going to use is a disposable CPAP system with the tight-fitting mask that goes over the head, okay? And this is going to go over nose and mouth. Then with the connection to it, okay? So connection, and this is actually your PEEP valve. So positive end expiratory pressure, so your centimeters of water. So you can adjust this with the flow.
I was trying to figure out this.
Just guess.
Yeah, yeah, so you won't have to guess. And there's no dial for this, but there is a handy yellow tag on here that says, if you want CPAP to a pressure of 5, you put it on 8 to 9 liters per minute from the oxygen, okay? So this is going to be attached to the oxygen. This is going to be attached to the mask itself. And as you increase flow, it will show you where you're at in terms of the oxygen. And so for us, we're not going to go above 10 centimeters of water. So you're going to stay in this first half of the green zone there, okay? So on this, it shows 5 centimeters of water for continuous positive airway pressures, 8 to 9 liters. 7.5 is 10 to 12, and 13 to 14 liters will give you the 10 centimeters of water. So that's the max, okay? Another good thing about this specifically is so you can also do an inline neb with this. So you can put the neb in between here as well. So you can put the neb vial. Obviously you don't need the mouthpiece. So that fits in there as well if you're going to do the neb in line with it, okay? So, go to the next one. You might see other CPAP machines. So there are machines kind of like a ventilator, but not with as many buttons, where you can set it. So we are not going to use that right now, but this is also the one that's available, okay? So we're going to do a little bit of skills competency in terms of putting it on, okay? So everybody that's here is going to practice putting this on. One other person, hooking it up to oxygen and setting the pressure. Do we have an oxygen tank? Yeah? Okay. So,
are we going to put it on the mannequin dummy or somebody else?
I think, what do you think?
I think we should
put it on each other.
Yeah, I think it's valuable to feel it yourself.
I think it is valuable to feel.
A lot of people get pretty anxious
Can
over
I take it home and try it for a CPAP machine for tonight?
No.
It's too bad.
Mike's like, sweet, $60 CPAP machine versus a $2,000.
Yeah.
Well, everybody says I should go do that sleep test, but I probably need a CPAP.
So, I'm going to put it on myself first, okay? So this is adjustable in terms of height. So these two kind of go right against the forehead. Just go like this. And I can't really see what I'm doing.
She's going to rake her earring off in a second.
There we go. So then you need to adjust this.
And it squeezes.
Yeah.
so that's how it tightens it. You don't have to mess with the straps or anything. Just that.
The straps are Velcro, so you can tighten the straps as well. Yep.
So that's how it goes.
Okay. So,
Doesn't want a little claustrophobic after.
do you have just like some alcohol wipes?
Yeah. I was like, I'll grab the Clorox wipes. I was like, this probably not good for
Yeah,
your
I just do alcohol wipes.
I'm not scared of Clorox.
So yeah, so that's so kind of the important part is making sure that you have these two against the forehead, and like you may need to adjust this up and down.
You just squeeze that.
Yep. So you squeeze these two together,
Okay.
and you go up and down
Okay.
like this as you need to. This is a size medium, so we'll have multiple sizes. You know.
For children? Is there like for young children?
Yep. So there's one. So the small is for children.
Okay.
The medium is for a smaller adult. This seemed like, I mean, I could have probably used possibly a bigger one, but I think I could also use a medium on myself. And then the large is for adults.
And that
So-
would be, what size is that one?
So this is a medium.
Medium.
So who wants to try putting it on Darby?
Okay.
You bet. Any way to torture her.
Okay.
Probably with long hair. Does this swing up while we're doing this?
It can,
Oh, I
yes.
see. If I hook
You
this,
can
it's-
do
You can unhook both of those.
That's what I was wondering. I'm gonna come behind
Yep.
you. Sorry.
Oh my gosh, your
Take
nose.
it out, like,
You didn't need that nose.
close enough. And so,
Yep, you can make that. Yep, you can adjust that. Yep, so that's as big as it gets right now. So yeah, put those against the forehead.
wow, I don't like hair.
Shit, I can't wait till they put it on my head.
And somebody, you can ask for assistance. I can hold this for you. It's always really good to
So-
let them know.
So now, this needs to come up because does that feel like it fits tight?
And then you can kind of see, you can kind of test. So okay, if we made this smaller, that is going to make it quite a bit tighter.
And that also, it also pulls up
It
right
did it pull
there.
up on there? Okay.
Yeah, so you got to bring it
So
down.
there.
Okay, so now hook it up to the oxygen.
Please hook it up to oxygen first.
Probably should do that first. Can you breathe?
Yeah, I can breathe right now, but not if you suck into that one.
Right, I was gonna say. You're probably not gonna
We
breathe.
should probably have that part ready though, because we're gonna freak out, especially if they're having
Yeah, so
problems breathing. That's on, Mike.
it's on.
Yep.
You do need to coach people through putting this on, okay? It's like, I'm gonna smother you with a pillow, and then I'm gonna open up your
It
airways,
seems like it's loose.
okay? So in people that are already kind of freaking out,
She said.
you know, if they're having like a nasal cannula on first, kind of leave that on while you're getting everything ready to kind of make sure that they're
Age
doing
is
okay.
5.
And then when you're ready, you can take off the nasal cannula.
And if somebody can't handle it, then you
I'm gonna start
take it
that
off
at
and go.
6.
Yep, you can go back to like a nasal cannula or the non-rebreather.
All right.
Okay, so what are we
she's
at for?
She's at about 3.
Okay, so if you wanted to, and what is that liters per
This
minute
is
right
saying
now?
right 6.
Okay, yep.
So if I go to 8, that should put us at about 5.
Yep,
That's
so right about 5. So, good. Okay,
You don't like it?
yeah.
Take it
Okay,
off.
you want to shut that off? Whew. Okay. So, you passed your skills test. Good
Good job,
job.
Mike.
With or without hair, I could have did it without hair better.
Yeah.
Should have picked Joel or Don.
So actually, how about this? Once
I'll sit.
you do it, yeah, then you're
I'm gonna make it
you're the
easier.
model.
I'm gonna make it easier on somebody else because they're not gonna stand up tall enough to do it.
Okay, Joel, you want to go?
Yeah, sure.
Okay.
Lady baby, you okay?
Yeah.
I'm
So,
having trouble breathing.
yeah.
Okay, I'm
You
gonna
are.
pause this for